Welcome to the Health Tech Heroes, where we talk to innovators who are rewriting the DNA of healthcare. Today, I am thrilled to chat with someone who is completely rethinking how we do primary care. Dr. Stephen Charlap isn't your typical doctor. He is a physician turned innovator on a mission to transform medicine through the use of AI. As a founder of Soap Health, he has created something very amazing, an AI system that actually helps doctors to be the best doctors. However, what's truly remarkable is that before founding Soap Health, Steve built Health Drive from scratch and ultimately helped over 5 million patients. He has got this unique blend of medical know-how from NYU Med and his business smarts from Harvard Business School and research experience from Stanford University. But what I love most is his passion for making healthcare work better for everyone. Steve, I'm so excited to have you on Health Tech Heroes. Welcome to the show.
Thanks for having me.
All right, Steve, since we are going to talk about Health Tech Heroes, I think the origin story is really important. And when you created this idea of Soap Health and decided to spend your time, energy, and your expertise on Soap Health, what is that moment that changed everything for you and you were committed for Soap Health?
Well, I was running my second business, which was a primary prevention medical center. And as part of that business, I had done a personal deep dive into the field of primary prevention. Everybody knows about colonoscopies, mammographies. That's called secondary prevention. Primary prevention is activities that can actually prevent disease and help identify people at increased risk for disease where intervention can be earlier. And because I was reading a lot, I wanted to share the knowledge that I was acquiring. So I was giving a lot of lectures at a number of places across Florida at the time. And one of the themes was that a lot of our health is really controlled by our actions, not so much by our disposition. And then I had a bit of a wake-up call when my older brother, a practicing cardiologist, was misdiagnosed and ended up passing away from that misdiagnosis. And as a result, I ended up closing my second business and going back to essentially studying at Stanford, where I spent 3.5 years. And spending those 5+ years in academia, I decided that I had a very good grounding on the basis of why doctors make mistakes. Just to give your audience a sense of the numbers, at least 30+% of the time, doctors don't get the diagnosis. And 15% of that 30, or half of that 30%, they get the wrong diagnosis, up to half of that 30. The problem is so bad that nearly 400,000 people die and another 400,000 become permanently disabled every year from misdiagnosis. And the National Academy of Medicine now predicts that everyone will experience a misdiagnosis. So given the prevalence of misdiagnosis, coupled with the fact that according to the National Association of Community Healthcare Centers, 100 million Americans, or roughly 1/3 of the U.S. adult population, doesn't have access to primary care, I said, this is a huge problem. And then if you add in the fact that primary care doctors are decreasing in numbers to the point where mid-levels, nurse practitioners and PAs, now outnumber physicians providing primary care, with physicians graduating from school not wanting to go into primary care, there is a perfect storm here of primary care imploding in the United States. And so because of what happened to my brother and a deep-seated interest in doing something in memory of my brother, which is to save 1 million people from premature death or permanent disability, I'm now on a mission to eliminate misdiagnosis from medical practice, and as you said, to allow physicians to practice at the highest level of their license, and at the same time, where there is no primary physician, to provide access to affordable and accurate primary care.
Amazing origin story here, Steve. And this is all driven with passion and purpose. And I see where you are coming from. When I looked at your LinkedIn, the comments that you make and the way you have presented yourself on LinkedIn, it reflects the passion and the intensity and the purpose you have behind this. This is amazing. Getting into the specifics of autonomous primary care provider, how does it look in practice? Like what exactly happens step by step when we have this autonomous primary care
Yeah.
within the network?
So if you look at the name of the company, SOAP, SOAP stands for Subjective Objective Assessment Plan. It's a form of medical documentation, but it's also basically what doctors do. They talk to patients and they collect subjective information. They look at objective information, lab results, imaging results, past medical history, medications the patient is taking, etc. They put that together and they make an assessment. And based on that assessment, they develop a plan. So in order to create an autonomous primary care provider, what I like to refer to as the Waymo of medicine, you have to essentially simulate, but not get too carried away with simulation, because if you perfectly simulate a human being, then you're prone to make the same mistakes that a human being makes. And so you have to look at what can AI do that a human being can't do. And that's how you get to an autonomous primary care provider. So for example, the first thing we can do that a human being can't do is we can spend all the time in the world with the patient that the patient is willing to invest in providing their most comprehensive personal medical history. We have hundreds upon hundreds of potential questions to ask patients. We use both combination of hard-coded algorithms and AI to be exhaustive. We ask both questions with expected and anticipated answers, as well as open-ended questions. We use intuitive imagery as well as reflecting answers back to the user. We have built the perfect medical interviewer, perfectly patient, perfectly empathetic, perfectly available 24/7. Perfect in that it is more likely to collect more truthful, more accurate, and more comprehensive responses than your typical doctor. Why? More truthful? Because science has shown that when people talk to a digital human animated character, they're not afraid of being judged, okay? They don't need to make a good impression or manage their reputations. Why is that important? 2 years ago, a study showed that more than 50% of Americans lied to their doctors about things that might embarrass them. So starting with the most truthful responses. Also, asking questions when there's no pressure. You want to answer now? You want to answer in 10 days from now? That's up to you. You want to go check something before you answer? Go ahead and check. You want to put your medications in front of you and read right off the bottom because you don't want to rely on your memory? Do it. Do whatever you need to do to give the system the most comprehensive information about you. Coupled with, we pull all the data out of the electronic medical record and we reconcile it against your history in case you said something that doesn't make sense with what's in your record, or the record doesn't make sense, or you're both not making sense, okay? We call it discrepancies. We focus in to identify anything that doesn't make sense. And we ask you questions about things that don't make sense. So we get your perspective, and then we also flag to the physician things that don't make sense. So without going into the whole product, it is a very sophisticated product, and it is literally for the doctor and the patient that wants to get the right diagnosis high 90% of the time. Now, again, what can humans do? If you went up to the typical doctor and say, I'm going to put you in a room with a bed and food and a computer, and I want you to write down every diagnosis you can think about. If they break 1,000 diagnoses in that week, that would be impressive. 2,000, unbelievable. How many diagnoses are there? Give or take 28,000 plus diagnoses, okay? They can't think of 26, 27,000 diagnoses. And if they can't even think of the name, they definitely can't think of what symptoms go along with those diagnoses, okay? And they don't come to mind, those diagnoses, because we're taught in medical school when you hear hoofbeats, think of horses, not zebras. And how many common diseases are there? What is common? 1 in 100 patients have this disease, less than 1,000. So unless they remember some esoteric disease from medical school, they can't even think about all these diseases. Now, usually the reason they're common diseases is because they're common. But what about a common disease with an atypical presentation, which they haven't seen that presentation before? Again, so easy to miss it. That's why AI is the future of medicine, because it can look at and think about 28,000 diagnoses. In fact, we have a patent pending that takes that approach of start with all the diagnoses and get rid of the ones that are wrong. And by definition, you've started with the right one unless that disease has never been diagnosed before. So we've built a lot of proprietary databases that looks at symptoms and diseases in ways that no one has ever looked at it before. I told you this much about what we do.
And it's already mind-boggling. It's you're already looking at 28,000 types of diagnosis for every patient, and this has scaled the level of our understanding as a primary care to a remarkable level. One thing that I would love to explore your thought process is sometimes we say that okay, it is only 99% accurate, so there is 1% mistake, but we always want to compare how the humans do versus the AI does versus a perfect AI versus nearly perfect AI.
Yeah, there is no perfect. There's no perfect because you may not have access. And when I say you, our system will not have access, for example, to a whole genome sequence to someone with such a rare disease that it's not been documented ever. And therefore, nobody did a whole genome sequencing, and we don't find the mutation that is responsible for that disease. So 100% is not possible. Also, there is presentations that your lab results come back in the lab gave you the wrong results, okay? So unless you repeat them, you're dealing with wrong information. When I was a surgical resident, I had a patient who was in the intensive care unit, and the lab result came back. I was the second-year resident with a first-year resident assigned to the intensive care unit for 24 hours, and a blood sugar level came back, and it was so low that the medical student, the first-year resident with me said, look at this result, okay? This patient is in bad shape. We have to turn off their insulin drip. I said, if this number was accurate, this patient would be in a coma. I said, look at the patient, not the number. He said, oh, you're right. I said, send off another blood sugar, okay? We're waiting, that disappears. So we send off a third blood sugar while we're waiting for the second one to come back. The third one comes back, the sugar is really high. He says, we have to turn up the insulin drip. I said, if this sugar was accurate, this patient would be in a coma. I said, again, look at the patient. He's awake and alert. Then the second result came back and it was normal. Remember, the second result was drawn before the third result. Now, that was a big scandal at the hospital that 3 blood results came back for the same thing, sugar, and they were all vastly different. So that's another problem in medicine is we trust the lab that the lab results are always accurate, and they may not be. So it's not possible to get the right diagnosis 100% of the time. But if you have a process like the one we've developed, which makes it very hard to make a mistake and is more likely to catch the mistake if you make it, then you are likely to get to a very high level. The exact number doesn't matter. It's that you've done the right thing. And what do I mean it doesn't matter? Look, Waymo, which I referred to earlier, the self-driving cars, they drove 2 million rides last year. They had 200 accidents. That's a 0.1% accident rate. If the National Academy of Medicine, as I said, predicts that everyone's going to experience a misdiagnosis, which affects 350 million Americans, and we can reduce the error rate to 1 or 2%, how many lives are we going to save? How many permanent disabilities are we going to prevent? And let's understand something. You don't always die from a mistake. You could suffer terribly, and you could have a catastrophic cost to that mistake, which no one will take financial responsibility for. But what I'm saying about medicine is any patient can sue any doctor for any reason, but they're not likely to win unless the doctor did the wrong thing. Not because things turned out bad, but because the doctor did the wrong thing. AI could be trained to do the right thing 100% of the time. It may not get the desired result, trained and with a rigorous scientific process to do the right thing 100%. And human beings can't do that.
That's a remarkable insight, and thank you for pointing out that look here, the input data plays a big role in this, and sometimes the input data also needs to improve along with the AI technology for analyzing the data. Considering where the AI is coming in into the primary healthcare, what is the balance between the human and AI interaction? Where do you think the expertise of physician meets the analytical ability of AI? Where do you think is this sweet spot, Steve?
So I consider myself a futurist. What is a futurist? Somebody who thinks about the future and tries to approach it in an intellectually sound way, considering the opinions of others, including in my case, science fiction writers who imagine the world 50, 100, 500 years into the future. I believe, and I don't support this necessarily, but I believe that in the future, only the very wealthy will be able to access a human doctor. They will pay a huge premium. They will be vetted by the doctors because the doctors will be in a position to choose who they see. And they will probably even have to agree never to sue the doctor if a mistake is made. The rest of the world, the not uber wealthy, will interact with AI first, particularly around primary care. And only if the AI is stumped will there be a back-end human, or if the AI falters or malfunctions, then there will be a human in the loop. But the beauty of having an AI first access will be 24 access from anywhere, will be highly accurate, will be immensely affordable, universally affordable, because the cost of AI is expected to also come down. And so you'll have access to affordable and accurate primary care 24/7. So what am I basically saying? Doctors aren't going anywhere until doctors choose to go somewhere, okay? But I think there won't be enough human beings choosing to be primary care providers in the foreseeable future. Why? They are underpaid, overworked, burdened by ever-increasing medical knowledge, challenged by ever-emboldened patients. 2 years ago, a study showed that 9 out of 10 doctors reported being physically or verbally abused by their patients. Primary care in particular has been very hard hit. Reimbursement wise, they are not paid more than they were paid 50 years ago. That's in absolute dollars. In relative dollars, they're paid a fraction of what they were paid 50 years ago, right? People don't want to go into primary care. It's tough to be a primary care doctor. You don't get enough time with your patients unless you do concierge medicine. And so my vision of the future is this souped up version of the concierge doctor.
The way I was approaching this was actually quite wrong in a way that you have changed my view a little bit on that aspect that, hey, look here, the primary care doctors might lose their jobs or lose their position. But what this system is allowing them to do is to avoid the burnout so that they can think about higher specialization at a higher level than the primary care, because SOAP Health has taken care of the primary care so that the doctors who are highly qualified can think at the higher level. So
But here's my yes.
this is actually should be looked at as a positive aspect even from the primary care physicians, because it releases their time to do something more intellectually rewarding, perhaps.
My fear is that those who pay them, when the doctors start using AI and they're able to be better doctors, more productive, they might cut their reimbursement even further. And so the doctors 50 years from now might still be making what they're making today, but using AI. And so I think it's very tough to be a primary care physician, and I'm not sure I see a solution on the horizon other than using AI. And as I say, the best primary care physicians will be able to muster, based on their credibility and their reputations, small groups of patients willing to pay a king's ransom to see them. And the rest of us will go the way of the ATM machine versus the human teller. You know, we used to have a relationship with the bank teller. Now, most of us have never met a bank teller. The ATM is as close as we get to the bank. We don't even step into the bank.
You don't actually go into the banks at all anymore. Very true. And it's remarkable that it can happen at the healthcare level.
Yeah, I mean, if you think about ATMs, it's a perfect example because you used to go to the bank, in the bank. Then you went to outside the bank with the ATM. Now you go to your computer to do your banking.
Yeah, absolutely. Just take the picture of your check and there it goes. And you can transfer money anytime to anybody.
Or Apple Pay. I mean,
That's
like,
yeah,
you don't even need cash.
yeah,
Like if
exactly.
somebody gives me change these days,
Yeah.
it's like it's a nuisance.
Yes, I really have such a tiny wallet that I don't even know where to put the cash or the coins in. Absolutely true. That brings me to the next question, which you alluded, but I would love to double click on it. Now, you have several stakeholders for you: the physicians themselves, the healthcare systems, the payer system, and the patient system. At a macro level, where do you think is the highest resistance for you? At a micro level, as a business, where do you find your biggest challenge?
There is a legitimate resistance in general to validating AI, okay? And that's why I tell people it took Waymo many years to put a driverless car on the road. And actually, they spent almost $30 billion, okay? So it's not a simple process to build something autonomous, which is why I take a lot of flack on spending all our money on product development and almost no money on sales and marketing. People are like, you got to make money, you got to make money. And I say, look, the first thing I got to do is build something that is trustworthy and reliable. And if I do that, the value proposition, given all the issues that confront primary care, are obvious. Of course, somebody would use it if it works properly. So my first responsibility, both as a member of society, but also as a physician, where the first rule, the Hippocratic Oath, is first do no harm, is to get this right. And because I'm on a mission to do it in memory of my brother, because I don't take any compensation, because I've invested millions of my own money in developing this, I'm going to do it right. And when it's right, then it will be sold and my investors will make money. And investors who want a quick return, I'm not the right guy for them. Okay? But investors who want potentially the first trillion-dollar product in healthcare, we may be the people for them.
I really have a good feeling about this, and you are getting at a marketplace that is like wide open, and you already have a product that you are confident is going to work, and there is a need. And considering the 30% of those undiagnosed patients, I think we are filling up a huge unmet need. And that's where, like, I'm so excited to talk about this health. I think, alluding to your point, as an entrepreneur, you do have a lot of priorities to balance. My question to you is, as an entrepreneur in a health tech industry, what has been your biggest challenge, or anybody who is new to the health tech industry, what would be your advice to these entrepreneurs?
Staying power. The biggest challenge is when you are trying to build something exceptional, like a airliner. You're going to build an airliner, it can't be pretty good, right? Nobody's getting on a pretty good airplane. You can't leave out parts. You can't be rushed to market. It's like the Challenger spaceship. They rushed it and they didn't address a problem with the O-rings, and the ship blew up shortly after takeoff. Okay? I won't be part of something like that. So the biggest challenge is funding a very ambitious project, particularly when most funding sources are looking for a fast, immediate return. Finding somebody with the vision to back a project like this is like looking for a needle in a haystack. So that's the biggest challenge. Fortunately, I have relatively deep pockets, but I don't have deep pockets enough to carry this to fruition without finding that needle in the haystack. So that's the challenge.
Out of curiosity, is there a point where you know this is less than perfect, but there is more human in the loop?
We are selling it to doctors because there is a human in the loop, so we feel comfortable that it's at a level that it already does amazing things.
So there is a revenue stream that can support the development to make it actually perfect.
We're going to sell some of our modules that are not as deterministic. In other words, we have something called an annual wellness visit. It doesn't diagnose. It just collects the information for the doctor to know what to do, but it's not like they have to figure out what to do. It's very clear what to do. Patient didn't get a vaccination, tell the patient to get a vaccination. Patient is at drinking too much, offer them alcohol counseling, okay? You don't need AI for that. But where the AI comes into play, it's able to do the intake for the doctor, including a cognitive assessment, including advanced care planning, including activities of daily living. So that's a product that we can sell already. Now, I don't have a salesperson, so it's a little bit tough to sell it, but I have a lot of partnerships that they want to sell it for us. So we're willing to give them the products to license it out to them for them to sell it. But again, it's very difficult to build something that Google built the equivalent on driving cars for 30 billion, and we're trying to build this for millions.
And I'm a big fan of Waymo. I use Waymo all the time. Sometimes it is definitely more safer than human drivers. I feel that because it just observes so many data points than we can do. And really, it does not have a peripheral vision. Everything is actually a focused vision for it.
It is much better at preventing accidents than humans are. That's the bottom line.
Very true. So you aim to save million lives, and can you give us how's that mission going? And can you give us one example that is very close to your heart where your technology has helped a patient?
We have a lot of stories, okay, even within the company. We have a person in the company who did the intake over a year ago, a relatively young person, and the product flagged that this person was at risk for something called cardiomyopathy, person in their 30s. And cardiomyopathy means abnormal heart muscle. Usually means it's ballooning, getting bigger. It's the only muscle in the body that you don't want it to get bigger. And the person ignored it. The person said, I'm a young person. This product says I'm at risk. It's probably just risk mongering, as they say, and ignored it. One day in the middle of a meeting, the person disappears. We're all wondering, where did the person go? Well, the person was rushed to the hospital, secondary to complications related to cardiomyopathy. That's one story. Another story is one of our engineers, his fiance, was having a very bad cough, went to the doctor. The doctor made a diagnosis, prescribed something. The cough wasn't getting better. He said, let me try soap. Tried soap. Soap said, we think it's this diagnosis. She went back to the doctor. Doctor said, yeah, could be. Changed the medication. No more cough. Third case, a young person came into a clinic, said, we're having headaches on and off for a few days. I won't give you all the details. Based on the intake, doctor was going to send it to a neurologist. Failed to mention to the doctor and nurse that she was being sexually abused. Shared it with the digital human. Referral to the neurologist was canceled. She was sent to a mental health counselor. Okay? A patient that carried a notebook to every appointment, so the doctor never knew the full history, finally had her full history in front of him and flagged her based on the system for increased risk for colon cancer. She had genetic testing done for the colon cancer. There's a lot of stories of this application catching things missed by your average doctor.
Yeah, these are, sometimes I just don't know how to react to such stories where people are going through this, and how remarkable it is that Soap Health is identifying this and then rinse and repeat this for millions of patients and millions of patients. The quality of life and the length of life, everything is an outcome which can be improved with this. And thank you, Steve, for doing such amazing work. I think we can talk about this for perhaps 3 days, 4 days, 5 days continuously, but I think we might want to come to an end here. But before ending the recording, I would love to give you 90 seconds for a pitch for something you want to tell the audience and want them to hear loud and clear about you, about your product, and how this is going to change the world. And the stage is yours, Steve.
The first thing I would say, go to your doctors early. Make sure your doctor understands everything that you've said. Make sure your doctor takes the time to consider all possibilities, even uncommon possibilities. At least consider it in order to reduce your own exposure to misdiagnosis. In terms of soap, as you heard me say, we need more money to complete this project. You God willing, but it will take time. If you know somebody that has lost somebody and feels that pain and doesn't want anybody else to experience it, like me and my president who lost his wife of 18 years to cancer, then please introduce us. You can find me on LinkedIn, Stephen Charlap, MD, MBA. The Soap Health, hello@soap.health. We're trying to do God's work here. And even if you don't believe in God, it's the closest thing to it, because nobody should die from a misdiagnosis. Nobody should permanently be disabled because of a mistake that could have been avoided.
And with that, thank you very much, Steve. I truly appreciate your time today. And I have heard your message clear and loud. I hope the audience also hear it loud and clear. And thank you for that.